for more now, we bring in infectious disease doctor Celine Gounder, a member of President-elect Biden's COVID-19 advisory board. Thanks so much for joining us, Dr. Gounder. Let's start with Biden's new plan to release nearly all available vaccine doses instead of holding some back for second doses. Why is this the best option, and what happens if production simply can't keep up and second doses are then delayed?
Lindsay, I do want to make clear that the recommendation remains that people should still get their second dose at 21 days or 28 days after their first dose, depending on whether that was the Pfizer or the Moderna vaccine. That second dose should still arrive on time. But what we've realized is that the vaccine rollout has had some hiccups. It's been a little bit glitchy. And we, in a sense, are getting in our own way, making things more complicated than we think they need to be. And we do have confidence that any technical potential issues aside, that the vaccine supply is on target to be where it needs to be. And so by opening things up and not withholding that second dose, we're really just making it easier to get the vaccine distributed, but still plan to make sure this gets administered on schedule.
And you just, of course, restated how important it is for the 21st and 28 days. So how important are those timelines strictly as far as making sure that people get them? And what's the risk of deviating from those timelines?
The risk is that the vaccines simply have not been studied in that way. So it is a data-free zone whether they will be as effective if the doses, the first and second doses, are spaced further apart. We don't think a week or two delay is going to make a huge difference, but at the same time, we really do want to recommend that people stick to the schedule. This is really more of a how are we managing the supply chain. We're not recommending that people wait to get the second dose.
And as you know, there's been a lot of finger pointing over the vaccine rollout. HHS Secretary Alex Azar accused governors of leaving vaccines sitting in freezers and said the perfect cannot be the enemy of the good. Do you agree with that? And how can the Biden administration help states and local authorities work faster to get the vaccines into more arms?
We're going to do as much as we can as quickly as we can. We are a year behind. There's a lot of planning that should have started about a year ago. Everything from looking at staffing where, here's a pandemic. We know we'll eventually have a vaccine on our hands. How will that vaccine get into people? Well, that clearly is going to require a lot of vaccinators. And the kinds of things, that needed to be done much sooner are not partisan issues in terms of the staffing issues. It's things like, really boring things like scope of work. Who as a healthcare worker can deliver a vaccination? Can a dentist or a veterinarian deliver a vaccination? But those are regulations that need to be changed at the state level. We also require people to be licensed at the state level. So me working in New York City, I cannot go over to Newark, New Jersey, less than an hour away with my New York medical license. So these are all just bureaucratic obstacles that really needed to be addressed sooner. And we will be addressing all of those kinds of bottlenecks as quickly as we can.
And lastly, are you concerned at all about wealthy or well-connected Americans trying to jump the vaccine line? And how can you ensure that the process is fair and equitable?
At the end of the day, anybody getting vaccinated is a win. This is an infectious disease. And so if you're trying to reach a certain level of immunity in the population, every person who gets vaccinated is good, not just for themselves, it's good for the rest of the people around them. And I do think many communities of color, part of their hesitance is that they don't want to be first in line. They don't want to be the guinea pigs. And so, hey, if a white privileged person happens to get the vaccine earlier and serves as the test case for communities of color to feel more confident, that's not the worst situation ever.
Wow. Okay. Well, just to recap, sounds like cutting the line does not appear to be a big concern. Dr. Gounder, thank you so much for your time. Once again, a Biden advisor on distribution of the vaccine.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.